I'd like us to just kick off by welcoming everyone to another Rolling Inspiration webinar to discuss our issue 4 for 2020. We didn't have an opportunity to discuss it last year, but we're hopping onto this opportunity today. And we're very excited to hear from all of our contributors about their articles for the last issue and gain some valuable insights as well.
A very good morning to you and to all our participants here this morning. Yeah, it is an exciting day for us today to have our webinar on our issue 4, which is our latest issue that came out, and the jam-packed issue with lots of interesting and very relative articles that we can relate to. So we're really looking forward to this experience that we will have during the day, and encourage everyone to stay tuned and to, if you have to hop off, just join us again with the same details as you have said in the invitation. And I'm really looking forward to this day. Thank you.
Yes, I'm very excited as well. And just for the readers who are not aware, Raven's currently at the QASA offices, which is why he's wearing his mask. We are still in the middle of a global pandemic and we do want to stay safe. So if you see him with his mask, that usually means there's some staff nearby. If he's sitting without his mask, that means he's alone. So we are making sure that we're keeping everybody safe. For those of you who don't know, my name is Mariska Morris. I'm the editor of Rolling Inspiration. With me this morning is Raven Benny, who's the managing editor of Rolling Inspiration, but also the COO of the QuadPara Association of South Africa, who actually owns and now publishes Rolling Inspiration. So that's awesome. In addition to that long list of things that Raven, responsibilities that Raven has, he is also a contributor for Rolling Inspiration now for quite some time. And in the latest issue, he discussed something quite relevant at the moment, which is pandemic fatigue. So Raven, please, can you tell us exactly what is pandemic fatigue for those of us who don't know?
Oh, well, it's interesting that you said for those of us who don't know, because by now we expect everyone not to only know about pandemic fatigue, but also to have experienced some of the pandemic fatigue. And I'm not going to read out the Wikipedia page of pandemic fatigue. If I can sum it up, I would say as being sick and tired of the pandemic and the restriction that goes along with it. But let me give you a more, I like to say, an educated opinion as to what exactly pandemic fatigue is. It's that state of being, as I said, sick and tired, worn out and tired, but not only of the pandemic, but of all the precautions and the restrictions relating to it, to the pandemic, and especially after some time, because we have been enduring, and I say enduring, all the restrictions that has been placed upon us. But we know that those restrictions have been placed upon us by our government to protect us, and also it was the reaction to the COVID-19 pandemic that we all are aware of. So that in a nutshell is what pandemic fatigue is. It's that state of mind or that state of being where you have had enough, and all the restrictions and the limitation of movements that is actually bearing one on your mental well-being, and that's also your state of mind. Yeah, that is what pandemic fatigue is. Yeah. We should all be aware of it, and we should all find ways of managing.
Yeah, and I think now that you've explained it, I think a lot of people can say, yes, I've actually experienced that. I know exactly what you're talking about. You know, getting tired of having to wear a mask or having to sanitize or whatever the case might be. But the fact of the matter is a lot of these regulations that are in place are there for a very specific reason. So maybe you can talk about the real implications tied to pandemic fatigue. What will happen if we don't take the pandemic seriously? And specifically, I can speak about, for example, the beaches where people might go to the beach and not wear a mask or not try and social distance.
Yes, and that is actually the danger of not obeying some of the restrictions or the rules that have been made. However, we as human beings, and we in the state of being we've had enough, more than enough. We know it's there to protect us, but we can only take so much of the restrictions. And we are at a stage now where we know that these measures have been put in place I think it was on the 15th of March 2020 that the government declared a state of disaster, and that has actually has entitled them to put these restrictions in place. So since then until now, I mean, it has been in place, we've had enough. But there are serious implications that will have a negative effect if we do not condone and if we do not participate and be sure that we are taking the necessary precautionary measures, because we suffer from anxiety and also the economic impact that it has played its toll on us. So now we're fatigued, we've had enough, and these if as soon as we will relax and do not take the precautionary guidelines seriously, there is an increased risk of not only catching the virus, but also of spreading the virus. So that is the serious implications if we do not condone or take serious the restrictions that is in place.
Yeah, I think, and that's a very important thing that you were mentioning there, Raven, is that the actual real implications of that is that, we'll see more infections, more people will get sick, that kind of stuff, which we obviously don't want to do. So in your article, you mentioned about Bluetooth technology as a way to help manage the pandemic. And we do know there is, for example, the COVID-19 alert app, which then monitors your movement and then lets you know if you are in close contact with someone who might be infected. So why are these things important, and why should people maybe think of including the Bluetooth devices in their way of helping manage the pandemic?
Mariska, yes, I mentioned it there because first and foremost, it was also one of the strategies that has been brought out to assist, to use the technology at hand to play that important role of not confronting the pandemic, but also it's crucial to slow down the spread of the disease. And the tech that we have available, I mean, as you mentioned, is built on the existing exposure notification framework. So it's easy for the technology that is around that will explain or indicate which areas has been where it has been contact, which person has been in contact with. It keeps an accurate record of it, because nowadays it's easy because our smartphones and our cars, or to connect our smartphone to our cars or our fitness devices or even wireless speakers, it's based on Bluetooth technology. And that is why I mentioned that it's in there. And especially now that we are all aware of the user privacy and security, and so it's also a technology that we do not have to have so much concern over. It has been around for some time, and it has been the most cheapest also technology that the government has used to assist us in the tracking and then keeping track of who has been or where you could have been exposed to the virus.
Yeah, definitely. And I think if I can just add to that, I would just like to say that, this technology is very advanced, and it's really a question of, you don't have to worry about your information being exposed. That's not how it works at all. It literally just works with Bluetooth devices, and you need to be within a certain amount of, a certain space away from someone. So it's within, I think it's within 2 meters. Yes. Yeah, you need to be in a specific radius. You need to be about 2 meters away from the person, and also for a prolonged period of time. So it won't notify you if you'd only simply walked past the person, but only if you've spent some time with that person, or spent a certain amount of time close to that person. So for example, if this person was sitting next to you at the restaurant, then it will notify you, that kind of thing. So it's quite significant and very important, and a great way to make sure that we keep safe. But on top of that, what I mention as to what we can do to help fight the pandemic fatigue.
Sorry, Mariska, I just lost you there for a bit.
Sorry, I was just asking, what can we do to help fight the pandemic fatigue?
Oh, yeah, Mariska, we've been at it for so long, and we know that in the beginning and the first a couple of weeks of lockdown, we all had set our goals, and we started baking and singing songs and find innovative ways of keeping ourselves occupied during the initial stages of the pandemic. Now we know we have each one of us has come into a certain pattern where we know what we can do and what we're allowed to do. But there's a few of the items that I want to mention also. And for me personally, exercise is very important. So we do have to stay active, whether you're a wheelchair user or not, or whether you're a person that has achieved quite a substantial amount of years already, you're quite advanced in age. There's no excuse for not being able to do any exercise or movement. So if you exercise and communicating, and one major item that I want to focus on is to lower your consumption of media. And I have also made myself guilty of that, where I would scour the social media and constantly watch the numbers on TV. And I could see the effect that it had on myself, also on my well-being. So my advice to anyone that is listening out there is to say that what we can do to fight the pandemic fatigue is, like I said, exercise, but to lower our consumption of media. We do not have to scroll through all our news feeds, but we should focus on not having that anxiety, because the anxiety that we are experiencing is actually fueled by that uncertainty, that fact that we don't know what might happen or what has happened, and that lack of the sense of control. But what we can do is to make sure that we have that quite a number of important values in our lives, and because it's actually those values that is threatened at the time of the pandemic. So that is some of the methods that we can do to fight the pandemic fatigue. But to reflect and accept, because we all know we've been at it now for almost 11 months. We know what has happened. So we reflect on it and we accept. One easy method also is to breathe. Do breathing exercise and to meditate, or find ways where you can just have a quiet space and a quiet place where you can reflect, as I said, and then breathing exercise, but also look after your well-being, restore and replenish your energy, and maintain your level of activity. And as I mentioned also, is that to monitor the use of social media.
Yeah, and I think that's a very important point that you make, in that, the kind of media that we're consuming really plays a big impact on how we do regarding this pandemic. And I think what we should be doing is we should first of all make sure that the information that we're getting is accurate, because despite the fact that we've been in this pandemic for over a year, we still get a lot of false information about how to protect ourselves, how to protect our friends and family, and also now a lot of information that's false about the vaccine. So first of all, make sure we're getting the right information. And then, as you said as well, not to torture ourselves by spending all of our time reading about this when it's not necessary.
Yes, Mariska, and I just must add now, because recently in the past few weeks, we all, and I say we all, I do not want to generalize, but many people have found out that initially it was just numbers that we see, but now recently in the past month or so for myself, so as it become more closer to home, we've seen that we have lost relatives, family members, neighbors. We do not deny that we do not have this pandemic, but we can see how it is affecting us closer to home. So we know this reality is around us, and we are alarmed, and we care about the people that we are losing to this pandemic. But we should also maintain our sense of self, because we are still responsible for us. We know that we mourn with those who mourn, and we feel sad about what is happening is. But what I want to I really want to claim that is important for us to do, to see how we consume the news and how we deal with what is happening around us, because we know now that we are in this pandemic. We do not know when the end is in place. I see that the Western Cape has mentioned now that it has reached the peak of the second wave. So there are learned people that do these calculations, but the general public is not sure how long it will last, how long we will still have to deal with this. But we have become fatigued to the pandemic. But there's very informative ways of coping with it. It's not just a coping mechanism, but we'd have to learn to live with this new normal, because it will never be accepted, because it has happened to the whole world. It has impacted on many communities in the most harshest of ways, despite the loss of life, which is a huge impact that it has on the loss of the economic activities we can see, and it's getting worse. So now that we are in it, we need to brace ourselves and to rely on what we have in the inherent characteristics that we have. And also, it's still, even though we are social distancing and we are kept apart and isolated, but we are still a community, a humanity. So we must still care about those close to us and the ones less fortunate than ourselves. And we are in this together to see how we can deal and navigate our way through this pandemic that's affecting the whole world.
Yeah, 100%. And I think something that you said, which is very important, that I just want to emphasize again for our readers, is the fact that probably life will never be the same again. I mean, we might go back to a world where we don't have to wear masks or sanitize every time we want to enter a building, but there will still be a lot of new changes that have happened in the last year that will stick with us. I think a lot of people will prefer to go more virtual. You know, I think traveling and things like that will be affected directly, and all of that thing. So we need to be just aware that, you know, life has changed quite significantly and will probably stay that way. I've gone through all of my questions and we'll continue discussing for another few minutes, but I do want to open up the floor for anyone who has any questions around the maybe about pandemic fatigue, or about the COVID-19 pandemic, or even just some questions for Raven. Please feel free to pop it in the chat and we'll take a look at it for you. But yeah, I think in the meantime, Raven, maybe you can just speak a bit about the vaccine and you know, what people can expect from that.
Yes. Thank you very much, Mariska. And let's first see if there's any of our participants that want to pose a question before I go into discussion on the vaccine. On my side, I do not see any reactions.
No, I also haven't seen. If there's anyone who might want to ask their question, I can always unmute you. So if there's anything like that. I see Ari has clapped hands. Ari, if that is an indication that you would like to say something, please just let me know.
Good morning, everybody. Thanks for the opportunity to pose a question. I inquire to QASA whether QASA is going to put a position down on the rollout of vaccines. Is QASA going to make a statement on the priority of vaccines for people with spinal cord injury, people with disabilities, maybe the South African Disability Alliance? That's a question should go to them. But what is QASA's stand? And how are you going to put your hand up so government acknowledges that if you do feel that we should be prioritized, the quadriplegics and paraplegics, how is that going to be done? How do the members of QASA know that we have got a brand behind us and lobby and advocacy for, you know, vaccine prioritization?
Thank you so much, Ari, for that question. Very valid question relative to the time that we are in now. And we are really considering to be vocal about the fact that we do believe that we are not seen as vulnerable, but we do need to be placed on the priority list higher up on the priority list when it comes to the issuing and the rollout of the vaccine program. We are in discussion with some of our partner organizations, as you mentioned now, the South African Disability Alliance, so that when the statement comes out, we are having a statement that taken everything into consideration. But what QASA will do is also to hear the feeling on the ground from the members, hear how they feel about the rollout of the vaccine, how they are looking forward to the benefits of being prioritized when it comes to the rollout of the vaccine. Because we do see our part in society. We know that we play an integral role there. We want to have the inclusion of us, as we have been insisting on for everything, and we do not want to be left out when it comes to the only hope that there is in the fight of this pandemic going forward. So QASA will be vocal. First and foremost, will be consulting with the members on the ground, so our regional associations and our board members, but first get the feeling from all our members as to how they will, how we will set out a statement of placing us high on the priority list when it comes to the rollout of the vaccines. I hope that answered the question.
I see Ari has just raised his hand again, so I don't know if he wants to add to that.
Thank you. Yes, I do. Raven, you're the COO of QASA. You know, how long is this consultation process going to happen with the members? The vaccine has arrived in the country, and when is it going to happen? And most importantly, how? So, or how or why? I think it's very important. If you pose a position of us as vulnerability, then we're sitting in a huge tank with many fish. However, my view is if you pose not only the fact that we are vulnerable, but that we are contributors to society. So what I'm saying is you need to put in your position that we provide education, we provide skills development. Now, those are things the economy needs. The better your argument is regarding contributing to the economy, the better it will be heard. If we're just going to use vulnerability of spinal cord injury, then we're going to sit with all the other losing arguments. So my theory is government should roll out first and foremost to the health, the first frontline health workers. Second of all, they should roll out to education, that kids get back to, they should vaccinate kids and adults at university and anyone working. So that's very, I know it's politically sensitive. Last of all, the elderly and the vulnerable, to be honest, because the only way that the economy is going to revive is for people to get back to work, to earn and consume. So to earn and spend. So we need to put in our argument, please. And I'm now putting my voice into into your feedback that you're looking for. That the argument needs to be not only our medical vulnerability, but second of all, our contribution to society in the respect that uh, we are employees and we are employers and we are getting skills and we are potential employees and we are students. So, you know, that's my contribution to hopefully you concluding your position statement as soon as possible.
Ari, thank you very much for that. And you mentioned that the last part of your contribution now you mentioned now, it is as soon as possible. And I want to just to point out, I'll use the example of the second last page on the rolling inspiration, where we feature businesses. We have a classified section there where we feed businesses. Nowhere on the page or in the articles or the adverts does it mention that those businesses are managed and owned by quadriplegics, because that does not matter. We make a contribution to the economy because we have members that run businesses. And when we make our statement there, we will focus on the contribution that we make, not being the vulnerable sector, but making that contribution despite all the odds that is stacked against people with disability. We are still the organization of persons with disabilities and mobility impairments there. And when we put out a statement.
Great, thank you so much.
Thank you very much.
If I may, I would also just like to add something to that, because I feel like it's something very important that Ari mentions around who will get the vaccine first. So those of us who were able to listen in to Ramaphosa's, President Cyril Ramaphosa's family meeting, also heard that he mentioned that he will be distributing it first to those with the healthcare workers who are obviously at the front lines and extremely important to how this proceeds, and then to people with comorbidities, the elderly, and then the general public. There were a few other people involved, but that's more or less the process that they wanted to follow in terms of getting the vaccine out in South Africa. And while I really appreciate Ari's point of view, and I think a lot of people will appreciate the angle towards the economy, I do also want to mention that at least from my perspective, I feel like people with comorbidities or people who are high risk are a better option, because as soon as we can get our hospital capacity lowered and we make sure that we have more than enough space for everyone who is ill, it means we can go back to lower restrictions, the economy can be opened up again, people can travel and go forward, because if someone then does get sick, we do know that there's more than enough space for them in the hospitals. So just keeping that in mind as well, taking care of our taking care of our high risk individuals is also a great way of taking care of our economy. Okay, Raven, I don't see any other questions or anyone else who has raised their hand. Just a reminder, guys, there are a few more minutes left in this webinar, in this session. So you are more than welcome to raise your hand or submit a question in the chat. We are also live streaming to Facebook, and I have put out a little note on the Facebook chat as well, saying to everybody, if they do have any questions, to please just let us know. But while we wait, maybe Raven, you want to make a last few comments?
Yes, thank you very much. Thank you for the input there, the valuable input there by Ari to the question that he asked, and some of the comments that you have made also. And as I just in conclusion, I want to wish everyone here that is accessing this webinar now also all the best for the way forward. Yes, although we are fatigued by the pandemic, it is here. I mean, we've been living with it now for almost, as I said, 11 months, and we have found unique ways and innovative ways of managing our lives in this new way and form that we have to. So I want to wish each and everyone well, and I also want to share my condolences with anyone who has lost some loved ones and family members and friends and neighbors in this, and also for the way forward, that we draw strength from each other and that we rely on the resources that we have at hand, so that we can continue not only fighting the pandemic, but surviving under the conditions that is being created by this pandemic as we go forward as a nation and as people with disabilities and as a community and as people. Thank you very much. That is my conclusions of remarks.
Great. Thank you so much, Raven. We really appreciate that. Thank you for taking out your time today, because Raven will be back for a couple of other sessions. He'll be hosting a few of the contributors in some of the later sessions in today. And thank you again so much, Raven, for your contribution to the magazine, for your contribution to the webinar. And we look forward to seeing you again today a bit later on.